cases. We also have the largest number of close contacts under medical observation. Recently, we have a great amount of outbreak, cluster outbreak. Many places, especially villages, have cluster outbreak, and we also see many chain of transmission. We do see some family outbreak and a school outbreak. And now we are facing a daunting task of prevention and control of the epidemic. Right now, we are approaching to the Spring Festival, and we have an increased number of population flow, which will increase the challenge of the transmission. On January the 18th, the State Council Interagency Task Force have published a guideline on epidemic prevention and control during Spring Festival. It requires all the localities to activate the prevention and control mechanism to improve the capability of nucleic acid testing and improve the efficiency and quality of the mass testing. And we have to step up efforts for the epidemiological investigation and also to improve our capability to identify the virus segmentation. We have to bring close contacts and the secondary contacts into quarantine. We need to do what we can for the treatment of the patients, and also we have to focus on the epidemic prevention and control in the villages, and also to the airports, communities, and people with concentration of migrant workers. We have to strengthen our efforts in the control work. We also have to strengthen the four-party responsibility, making sure that we can realize early reporting, isolation, and treatment. We do not let our guard down and also do a good job in the prevention of imported infection and domestic re-emergence. And today, we will talk about the prevention and control during the Spring Festival. We have a deputy from Ministry of Civil Affairs, Mr. Li Banghua, and deputy from the Ministry of Human Resource and Social Security, Mr. Chen Yongjia, a deputy from the Ministry of Transport, Madame Wang Xiuchun, and deputy from the Disease Control Bureau of National Health Commission, Ms. Wang Bing, and also a deputy director from China CDC, Mr. Feng Zijian, to attend the press conference. They will take your questions and respond to the social queries. Right now is the Q&A session. Please identify yourself before you raise the question. Now the floor is open. With Hong Kong media, as we are approaching the Spring Festival, and many cities appeal to the residents for the residents to stay in their workplace. So what measures have you take to ensure that all the residents can have a happy Spring Festival? I would like to give the floor to Mr. Chen Yongjia. So we do encourage our residents to stay in their workplace and spend the time for the Spring Festival. This will help us to better contain the epidemic and also reduce the population flow. And of course, we have to provide more care to these people who are staying in the workplace. Ministry of Human Resource and Social Security work together with the Ministry of Civil Affairs, Ministry of Transport, and other 6 ministries have made arrangements for the Spring Festival. We need to stabilize the employment and provide care to the residents. So we have to safeguard the jobs, and also we encourage these people to stay in their workplace and also provide more care to the migrant workers. So these people can stay in the workplace to spend the time of the Spring Festival. And also we provide some support to the enterprises. We have done the following work. First, we will provide more humanitarian care to the local residents. We will work with different localities to provide care to the local residents. And we will also encourage the enterprises to send out subsidies to their employees so that these people can spend their time in their workplace for the Spring Festival. Also, for the wages and the shifts, we have to safeguard all of these allowances to the workers. By doing all of that, we could encourage and maintain these people stay in the workplace for the Spring Festival. And second, we will strengthen the policies and safeguard the work positions. We will guide the enterprises to have a flexible schedule for the production and also to provide some work shifts to the employees. Meanwhile, we will also provide some subsidies to the local employees, to people who are staying in the mid and high-risk regions, and also to some of the key sectors. We are also providing some subsidies. We will even raise the cap for these subsidies. With this policy support, we are able to sustain these workers. Third, we will stabilize the production so as to safeguard the jobs and sustain the employees. We will have a mobilization scheme, especially to the key enterprises, and especially for some enterprises, if they have adequate manpower, they could transfer some of the manpower to other enterprises who are in need. And we also need to do this in fashion and also to create some temporary job positions. For some places, we will also encourage them, the local authority, to provide more support to the local enterprises. By stabilizing the production, we can bring more job opportunities to the local employees. Fourth, we will improve the services to sustain the workers. We will provide online and offline services for the employment. We will provide different kinds of job hunting activities. So for people who are losing their jobs, we will provide some temporary subsidies to safeguard their life. We will improve our services to making sure that we can safeguard their jobs and ensure their daily life. Going forward, we will continue to work on all of these policies, making sure that all of those measures could be implemented. By doing that, we can stabilize the employment and also provide more care to the migrant workers who are spending the Spring Festival in their workplace. Thank you. Next question, please. With Xinhua News Agency, and right now under current such epidemic situation, how could we do a good job in the epidemic prevention and control in the elderly homes? How could we ensure the healthy status for all the elderly people who are staying in the nursing homes? I would like to invite Li Banghua to answer this question. Thank you for your question and your attention to the elderly people. So for the elderly homes, we do have many people staying there, also with underlying disease. So for the Ministry of Civil Affairs, we have attached great importance for the epidemic prevention and control in the elderly homes. So start from last year, since the outbreak of the epidemic in Hubei province, so for over 40,000 elderly homes, they registered zero infection in China. And right now, we do not see the elderly people or workers who are working in these facilities to get infected. And right now, we are stepping up our efforts for the epidemic prevention and control. So actually, we have mobilizing 4 tiers of the civil affairs officers to conduct our work in the control measures. And earlier, we actually published a guideline on epidemic prevention and control in the areas of elderly homes during Spring Festival. Just a few days ago, for the Ministry of Civil Affairs, just had a conference to talk about the epidemic prevention and control in the elderly homes and the children care homes. And right now, all the authorities have been taken their actions to do a good job in the control measures. And second, And for the elderly homes, and right now they're entering into a stage for the normalized prevention and control. And when necessary, we will exercise lockdown to these elderly homes. We have some workers to provide daily necessities and the supplies to the elderly people who are staying in the nursing homes. And this year, we have already started this work. We have exercised lockdown to those elderly homes, and we do not allow other people to come visit. And also, we are doing disinfection to those elderly homes. If we have a mid and high risk region, we will continue this kind of lockdown exercise until the epidemic is over. So right now, we have suspended the visiting hours for the elderly homes. Please understand our decision because we really want to protect those people who are staying in the nursing homes. And we also have a regular check of the health conditions of the people who are staying there. And also we are rolling out the nucleic acid testing to the workers and also people staying in the elderly homes. And also we are doing disinfection to every corner of the elderly homes, making sure that we will not bring about the secondary disaster or disease. And fourth, we will provide more care and support to people who are staying in those places. We are abiding by the epidemic prevention and control regulation. And inside of the elderly homes, we also organize some activities and show more care and support. And also we will set up communication lines between the elderly and also their family members. Hopefully, with the stringent measures, we can ensure the safety and the health of the elderly people so that they can enjoy the Spring Festival this year. Thank you. Next question, please. Thank you. With Hong Kong media. Recently, we do see some cluster outbreak in different districts, and also we see a big increase of the confirmed cases. Why is that? So in which area shall we strengthen our weak links? I would like to give the floor to Ms. Wang Bing to answer your question. Thank you for your question. And recently, we do see the outbreak in Beijing, Heilongjiang, Hebei, and there was some cluster outbreak in those regions. We have some preliminary analysis of the epidemic, and there were some common features of this cluster outbreak. First, most of the outbreak are related to imported infection, seeing that we may have some people get infected and they're coming from overseas, and maybe we also have some infection coming from workers who are working in the cold chain logistics. And all of these could be the reasons to cause the infection. And second, we found some of these infection occurred in villages, especially in Shijiazhuang and Heilongjiang, and the cluster outbreak occurred in the villages. And third, we found there's a fast spread of the virus, and it is very difficult for us to handle the situation. Right now, we are approaching to the Spring Festival, and also we see an increase of the population flow. There may be some weddings and gatherings, and we have more gatherings, especially before the Spring Festival. This will also accelerate the spread of the virus. That's why we see a big increase of confirmed cases. And for certain districts, and we do see there were multiple transmission chain, and this will also pose challenges for the epidemiological investigation and the virus tracing. Based on that, we still have to stick to the general principle to prevent the imported infection and the domestic re-emergence. So actually, we have done the following work to strengthen our efforts in the epidemic prevention and control. First, we have to fill in the weak links in the prevention and control work, especially in the villages. We have extended our scope for the compulsory testing. So we require all localities to collect the samples first, And within 12 hours, we ask them to provide the results of the testing. We are actually raising with the time. If some people need to return to their hometown for the Spring Festival, they have to show a nucleic acid testing certificate with negative results. And after these people returning to their hometown, the localities have to do a grid-style management to this personnel. And also we have to do a good job for the disinfection for the quarantine site so that we can respond rapidly. Second, still we have to do a good job in the prevention of imported infection. When we say imported infection, it is not only related to human population flow. Also, we have to focus on the objects. For any people who are coming back to China from overseas destination, they have to undergo 14-day isolation and quarantine. After they complete the 14-day isolation, when they return to the community, they also need to exercise and abide by the regulation of the community. For each link, we have to make sure that we implement them thoroughly. In order to prevent the infection of the objects, we have to make sure that the workers have to protect themselves first, especially for the key groups of people and the key facilities. We have to strengthen our efforts in the disinfection. And for people who are working in the cold chain logistics, and these people will have the priority to receive the vaccination. And also, we have to respond quickly for the epidemic. Once we found there is an outbreak in certain districts or regions, by no time we have to activate the epidemic response. We have to extend the scope for the nucleic acid testing. NAT is our priority so that we could extend our prevention and control. We need to be decisive for the NAT, and we have to clarify the regions by different level of risks so that we can fully exercise the grid-style management to make sure that we are proactive in the epidemic prevention and control. Fourth, we have to provide more education to members of the public. Since the outbreak of the epidemic, we need every one of us to bear in mind that we have to wear the face mask, wash your hands frequently, and avoid gathering. These are all the good habits for the epidemic prevention and control. Especially during the Spring Festival travel rush, you have to protect yourself. As you are the media, we want you to publicize the information to the general public so more people will understand how to protect themselves, especially people who are living in the villages. So they have better access to the knowledge and they understand how to protect themselves during the epidemic. And also, we need the villages to understand the regulation from the local authorities so that there's no gathering, and then we can consolidate the hard-won efforts we have gained for the epidemic prevention and control. Thank you. Next question, please. With China transport, and the Spring Festival is coming, and we may have an increase of population flow, I would like to understand what is the expectation from the Ministry of Transport for the Spring Festival travel rush, and what measures have we taken to ensure the epidemic prevention and control during the Spring Festival? Thank you for your question. This year is quite unusual, and actually it is the first Spring Festival travel rush under normalized epidemic prevention and control. And we keep analyzing the travel rush situation in China, and we are also learning the guidelines from different districts, and also we are analyzing the ticket selling situation and also the number of passengers. It is estimated that during the Spring Festival travel rush, we will send out 1.7 billion passengers. So on a daily basis, we will send out the passengers of around 40,000 people. So 40% down as compared to 2019, and also a little bit increase as compared to 2020. Well, I would say it is a big decline for the number of passengers we have each day for 2021. But still, if we look at the daily passengers compared to 2020, we still have a huge pressure for the Spring Festival travel rush this year. So this year, we have to respond to the dual challenges brought by the epidemic prevention and control, as well as the Spring Festival travel rush, followed by the decisions from the CPC Central Committee and the State Council. And the State Council Interagency Task Force has actually set up a special task force to deal with the Spring Festival travel rush. We analyze the situation, especially the epidemic prevention and control situation during the Spring Festival travel rush. And we are doing what we can to contain the spread of the virus during 2021. We have done the following. First, we would do what we can to reduce the population flow. We will look at the travel of the migrant workers, the students, and also people visiting their families. We will encourage the government to require some of these people to stay in their workplace and do not return to their hometown. And also, we strengthen the information communication. The Ministry of Transport have made reasonable allocation of the transport capacity so that we can reduce the gathering and also the population flow. We will improve the prevention and control standards. For example, we will increase the frequency for the disinfection in the road transportation, public buses, and the other key sectors. And also, we will check the temperature for workers who are working in the transport terminals and also check the health conditions of the passengers. And third, we're actually formulating a prevention and control guidelines by regions and by level of risks. We're also analyzing the measures, what we need to do to deal with a sudden outbreak for certain districts. So we are looking at the information communication and also the disinfection in key areas. We will provide guidance to localities to prepare their local regulations so that they can respond rapidly. And fourth, we will prevent infection from human as well as objects. We have to make sure we do a good job in the prevention of imported infection, and we have to check the virus to see if we have some positive virus in the transportation vehicles and also the transportation containers, so that making sure that the virus will not be brought inside of China from the cold chain logistics. Thank you. The next question, please. With Phoenix TV, during the Spring Festival, many people may come out for shopping or for dining. So for these local residents, what are some of the reminders for them during the Spring Festival? I would like to give the floor to Mr. Feng Zijian to answer your question. Thank you for your question. During the Spring Festival, it is quite normal that the residents will shop outside or they may have dining with others. So our reminder is that make sure that you protect yourself if you are going out. Please done the following. In low-risk regions, if you are going to the shopping malls, first make sure that you have a plan. And please do the shopping off-peak. So if you're coming inside of the shopping malls, making sure that you wear your mask and also you bring disinfectant to wash your hands frequently. And we recommend you walk the stairs and do not use the elevator. And if there are so many people stuck in one elevator, make sure that you wait until there's less people inside of the elevator. And do not use your hand to touch the button inside of the elevator, and also exercise social distancing. And making sure that you avoid gathering. So do not visit those promotion counters frequently. And make sure that you wear your gloves to buy those products, and try to use contactless purchase methods to buy those products, and reduce the time to stay inside of the shopping malls. So make sure that you leave the shopping mall within 2 hours. If you are in a mid or high-risk regions, please abide by the local prevention and control regulation. And for people who are staying in the low-risk regions, and we recommend you stay at home for the dining. If you want to eat outside, make sure you wear your mask when you are taking the public transportation. Do not use your hand to touch the handles or other public facilities when you order in a restaurant. Please make sure that you use the QR code to place an order. And if you're sitting in a room with no windows, so cut short the time for the dining. So after you complete your meal, make sure that you pay your bill with the QR code. For the mid and high-risk regions, on top of that, also you have to abide by the local prevention and control regulation. Thank you. Next question, please. Thank you. With CMG, in this year's Spring Festival, there may be some special features for the population flow for the migrant workers. So my question is to the Ministry of Human Resources and Social Security. What is the arrangement for these migrant workers for their travel? Thank you very much for your question, and thank you for your attention to the migrant workers. After the Spring Festival, we have another peak time for the back-to-work travel, and the Ministry of Human Resources and Social Security attach great importance to this issue. And right now, we have published a notification on the prevention and control in transport during Spring Festival, and we will provide more services to the migrant workers after the Spring Festival. In general, we have 5 measures. First, we provide the guidance to the migrant workers to go back to work. We will encourage the enterprises to publish more notifications and to use a very flexible schedules for the migrant workers. We will guide the migrant workers to go back to work in an orderly manner. And also, by looking at the actual situation as well as the prevention and control regulation, we will do a point-to-point transportation for the migrant workers. Second, we will encourage the migrant workers to find a job near their hometown, within which we have 5 areas of focus. First, we encourage the migrant workers to participate in the spring farming, so that these people can find a job near their hometown or inside of their hometown. And also, we encourage to set up more construction projects inside of village, so some of these workers can find a job in their hometown. They do not need to go to other cities to find a job. And also, we would like to encourage the migrant workers to start their own business in their hometown. And all of this can also help them for the employment. So this creates more job opportunities for the migrant workers. Third, we will organize a series of job hunting activities. We will have job fair online and offline, so that we can bring more jobs to the market. On one hand, we will focus on the demand for the migrant workers to provide more job opportunities to the migrant workers, so that we will have a dedicated job fair, online and offline, just to serve the migrant workers. And the second, we will look at the demand of different sectors to provide the support to the enterprises. And we will have a very targeted job fair to different sectors. Fourth, we will provide some trainings. We will have 131 employment scheme, making sure we provide 1 time of job training and 3 job positions and 1 job training program to the workers. So we will provide targeted trainings to the workers and provide the trainings to the migrant workers to start up their own business. By doing that, we can meet the diversified needs of these migrant workers. We will do what we can to safeguard the labor rights of the migrant workers. Fifth, we will focus on the key areas to give priorities to certain group of people, especially we will target impoverished residents, especially people staying in the villages. We will give priority to these people and organize the job fair to help these people. By doing that, we can consolidate our efforts in the poverty alleviation and also to contribute to the rural revitalization. We are making sure that we will help and save those who are in need in the village. The employment work for the migrant workers is our key priority. After the Spring Festival, we will do what we can to bring these migrant workers back to work. And thank you again for your attention to this issue. Next question, please. Thank you. With Reuters, right now, China is requiring for all the arriving passengers to have 2 certificates, the NAT negative certificate and also a antibody IgM negative certificate. So for some people, if they're getting vaccinated, maybe they may have some issues with this testing. So what measures will be taken by China to facilitate with the population flow from the overseas destinations to Chinese mainland? Right, you are correct. For people who are coming to China, you have to abide by some epidemic prevention and control regulation. So you are saying they have to hold 2 certificates with NAT negative and IgM negative. And we do realize in some parts of the world they started the vaccination. So for China, we will also analyze all of the considerations you mentioned after the vaccination work started. Thank you. Next question, please. With China Daily, I have 2 questions. And right now, we do see some people are saying that the virus variant is actually 100% the same with the variant we found earlier. And also the second question is that start from December, we found some of the cluster outbreak in China. So why we have this reoccurrence of the virus? Thank you. I would like to invite Feng Zijian to answer your question. You're talking about 100% homology. And this means that maybe for some of the infected patients, they're actually exposed to the same variant of the virus. Or these people, they're actually in the same transmission chain. So that's why these people have the same variant of the virus strain. start from December last year, we do see some cluster outbreak in China, especially in Beijing, Dalian, Heilongjiang. There may be some cluster outbreak. According to our epidemiological investigation, we found for this round of epidemic has no relation to the epidemic we found last year. So according to the virus tracing, we found some of these viruses are imported virus. So for most of this infection actually because the virus was brought from the imported human or imported objects. So this means these cities may have some exposure of the imported infection. They have a risk of the exposure of this virus. That's why there is a reoccurrence of the epidemic. Thank you. Next question, please.
Emma O'Brien from Bloomberg News. I've got two questions. The first one is, how many people are you planning to vaccinate before Chinese New Year, and how do you plan to do that? Part of that question is also, what are the plans for vaccinating children and teenagers? And secondly, what are the prospects for bringing the Hebei and northern outbreaks under control before Chinese New Year?
好，请先翻译一下问题。
彭博社记者，我有2个问题要问。
These female journalists just have two questions. The first is about the vaccination plan in China. So what is the plan for the Chinese government on how many people will be vaccinated before the Spring Festival? And the second is also about the vaccination. We are asking whether we have a vaccination plan to include juveniles and children. And also, we attach great importance to the epidemic in Hebei and Heilongjiang. And what is the situation right now? I would like to invite Wang Bing to answer your question. And right now, China is still implementing the vaccination. In general, the process is very smooth. For our principles, we have to separate the city and the villages, and also we will give priorities to second key groups of population. This principle is based on the situation in China, that is to prevent imported infection and domestic reemergence. So right now for the vaccination, we are focusing on the border cities, and we are targeting some of the key groups of population, and also we are focusing on some of the workers who are doing their job to maintain the social order, and people who are offering the public services. So we will give priorities to these people for the vaccination. And the vaccination program is carried out smoothly. And right now, we have provided vaccination to over 50 million people. Actually, we have been doing this job in a very short time. Before the Spring Festival, we are still following the existing guidelines to move along with our vaccination program. In order to ensure the implementation of the vaccination, we have done the following work. First, for the State Council Interagency Task Force, we have established an expert group to provide guidance to different districts and regions, and they will help with the localities to formulate such a vaccination plan. And the second, we also analyze the number of people who are in the key groups of population. We will also analyze the medical resources available in the local districts to set up the vaccination sites and provide trainings to the vaccination personnel. And also we are giving full play to the information technology. And for other people who are receiving the vaccine, will register their information because each one of them have to take 2 doses of the vaccines. So all of these are necessary. Fourth, during the vaccination progress, we will abide by the requirements to standardize the vaccination. To each one of the testing subjects, they will receive a very standardized vaccination. We have to ensure the quality of our medical service. For example, we have to record to see whether there are some adverse reactions to make sure that everyone is safe after they receive the vaccination. So these are our plan for the vaccination. I believe before and after the Spring Festival, we will continue to move along with the vaccination program. And going forward, we also analyze the situation and also to extend our vaccination program to include children and the elderly people, so an ordinary resident can receive the vaccination so that the vaccine can play an even stronger role in the fight against COVID-19. Thank you very much. Also, I would like to invite Mr. Feng Zijian to share some of his thoughts about the epidemic in Hebei and the northeast of China. Since the outbreak in those 2 districts, and we could see the local government has done a lot of work to contain the epidemic. So for some of the key measures include testing, diagnosis, and treatment. Once we found the confirmed cases, we'll bring them into quarantine and isolation for treatment. We will also step up our efforts to identify the asymptomatic cases to cut off the transmission chain. And also to relevant communities, we will exercise lockdown or stringent measures. In the past 1 year, our efforts are proven effective. With the implementation of our prevention and control work, I believe we will further contain the epidemic in Hebei and the northeast part of China. And right now, we could see each day in Hebei, we do see a basic containment. And in the northeast part, especially in Heilongjiang, we are still exercising the epidemic prevention and control measures. I believe with the continued implementation of these measures, the situation in Heilongjiang will be further improved. Thank you. Thank you. Next question, please.
谢谢主持人，我是第一财经的记者。近几年春节有不少人选择了通过。
In recent years, during the Spring Festival, some people would like to use the car hailing service to go back to their hometown. Right now, the epidemic situation is very severe. In order to ensure the safety of the passengers, what measures has been taken by the Ministry of Transport? I would like to invite Ms. Wang Xiuchun to answer your question. Thank you for your question. Indeed, we do realize in previous years, we do see some people who are using car hailing service to go back to their hometown. They may share the same vehicle with others. And previously, we would say this is actually quite a green way for the transportation. But right now, the epidemic situation is quite complicated. And in certain places, we found some of the rental car drivers, they are tested positive for the virus. So this means we may have some risk of the car hailing service. So we need to attach great importance to this car hailing service, especially during the Spring Festival. So we have to supervise, give guidance to the car hailing service contractors to do a good job in the epidemic prevention and control. I would like to emphasize 2 aspects. First, we have to curb the spread of the epidemic. For different localities, they have to exercise the notification published by the local authorities, especially in the mid and high-risk regions. In mid and high-risk regions, they have to suspend parts of the car hailing services. For example, they may suspend the intercity transportation by using the car hailing services. And for different regions, in accordance with the actual situation, they could extend the scope of this car hailing service. We also encourage some of these car hailing companies to use a more scientific way for the regulation of their service. For example, they could suspend the car hailing service in the mid and high-risk regions. They may also provide some optimized routes for these transportation routes so that these cars will not bypass the mid and high-risk regions. And second, we will exercise the epidemic prevention and control measures. They have to clarify their responsibilities and provide education to the drivers and to do a good disinfection to the cars and check the body temperatures of the drivers as well as the passengers. By doing all of that, it could make sure that the virus will not be transmitted through car hailing service. And also, we need to provide more guidance to the drivers to register the information of the passengers if there is an epidemic or there is a confirmed case, and these people could cooperate with the epidemiological investigation. And also, I would like to focus on the safety management. For the car hailing service companies, they have to hold on to the bottom line. They have to check the background and personal information for the drivers, and at the same time, they have to protect their personal privacy. And they have to safeguard the legitimate rights of the passengers, and we have to crack down all of those illegal car hailing service. Thank you. Next question, please. Thank you. And recently, in UK, Brazil, and South Africa, we do see some mutation of the virus. Some scientists are saying that for this kind of mutation, it may affect the efficacy of the vaccination or the vaccines. So my question to understand the efficacy of the Chinese-made vaccines. Actually, we have a deputy from Sinopharm, one of the vaccine developer, to join the press conference, and he will also answer the questions for you. Thank you for your attention to the vaccine. For the biotech vaccines, start from the R&D, we have focusing on the mutation of the virus. We attach great importance to the development of our Sinopharm vaccine. So right at the beginning, we actually are analyzing the variants and different mutated virus for comparison and analysis. And last year, before we approve our vaccines and make it available to the market, we also collecting some of the variants and to do further testing on the efficacy of our vaccines. We believe our inactivated vaccine could protect the human body from all the mutated variants. But we do found recently, we do see new variants of the virus, including those variants in UK, South Africa. And now we are paying close attention to the variants that we found from those places. We are continue to doing the testing to verify the efficacy of the inactivated vaccines developed by China, and we will continue to follow up with the situation, making sure that we do a good job in the R&D in the vaccines in China. Thank you. Next question, please.
谢谢主持人，我是封面新闻的记者，我的问题也是关于这个。
With cover news, my question is also about the Spring Festival. And right now we have 29 provinces. They have encouraged the local residents to stay in their workplace and do not return their hometown for the Spring Festival. And because of that, there may be some elderly people staying at home alone for the Spring Festival. So what measures will you take to ensure that all of those elderly people, especially those let alone elderly people, can enjoy the Spring Festival during in this time? So actually, we do see in this time, in the epidemic situation, some of the people are not able to go back to their hometown and be with their families. And we do see some people, they're living with difficulties. There are some left behind elderlies. And if they could not reunion with their family members, it's very difficult for them to have a happy Spring Festival. Actually, the Ministry of Civil Affairs attach great importance to this issue, and we are paying a lot of attention to the left behind elderly people and those people who are living with difficulties. And also for civil affairs office in different regions, they're actually trying to find out all of those left behind elderly people. And we do have a ledger. And right now, as we are still under the epidemic, so we have to find out who are they and whether their family members will come back to their hometown. And we have to understand the epidemic situations for those people. And we have to understand their needs, especially their needs during the Spring Festival. And third, for those elderly people who are living with difficulties, we have to provide support to them when necessary. So for example, we will have a routine visit to these elderly people to see how they spend their time in the Spring Festival. And if they have some problems, run into some problems, or if they have some difficulties, we will provide support when necessary. And also we will work with the elderly homes and also the local communities, the volunteers, so that they can provide some services to the elderly people. For example, they can show some care, and for example, they can deliver food to those elderly people. And at the same time, we encourage those people who are staying in the workplace for the Spring Festival, make sure that you keep contact with the left behind elderly people. Even though you are spending the Spring Festival in your workplace, but still, you need to remember your parents. Please make a phone call to your parents. So even though now we are under a tough situation of the epidemic, but still we have to show care to them. And also the community workers need to show care to those elderly people. Thank you. Next question, please. With CMG, Ms. Wang Bing just said, right now we see some of the cluster outbreak occurred in the villages. And according to the epidemiological investigation, we do see, for example, the weddings and gatherings may bring some risk for the cluster outbreak. And right now, we do understand we do not have available resources or limited resources to help with those people who are living in the villages. So what is the measures taken by the Ministry of Human Resources and Social Security to support these people? Actually, you were right. And we do have limited medical resources in the villages. And for the local residents, they do not have a strong awareness for the prevention and control. Back in 2020, when we see the weather is getting cold, the National Health Commission already come up with documentation to provide guidance on epidemic prevention and control during autumn and winter in villages. And this year, we also had a special task force to send out notification and guidance to facilitate with the epidemic prevention and control in villages. And right now, as we found some of the weak links in the villages, the State Council Interagency Task Force worked together with the Agriculture Department of China and published a notification on epidemic prevention and control in rural areas during spring and summer. And we have come up with many targeted measures. First, we advocate early prevention. We need to be proactive in the prevention work. So if there's no need, we have to avoid the gathering to reduce the risk. And the second is the early identification. We require the rural areas to extend the scope for nucleic acid testing. So for people who are coming back to their villages, they have to receive compulsory testing. And also in some public facilities in the rural areas, for example, for some of the recreational areas, we need to roll out nucleic acid testing to those public facilities. And also in the local drug stores in the rural areas, we need to monitor the situation. We have to register the personal information for the residents who are buying the fever medications. And the third area is the early reporting. Once we identify a suspected case, within certain time limits, they have to report these cases to the government. As we said, if we run the nucleic acid testing, within 12 hours, we need these people to provide the results. If we identify asymptomatic cases, within 2 hours, we have to report these cases to the government. And the fourth area is early isolation and early quarantine. If we identified asymptomatic cases, so for some of the local authorities, they have to exercise lockdown immediately, and within 24 hours, they have to complete the epidemiological investigation. For the close contacts, and these people have to be brought into medical observation. And to these for these close contacts, we need to roll out NAT, and also we need to do disinfection to some of the public facilities. And fifth is the early treatment. In rural areas, we need to have an accountability scheme to those local hospitals. If we identify suspected cases, within 2 hours, we have to transfer those suspected patients to designated hospitals so that they can receive treatment at an earlier stage. So at the very early stage, we need these hospitals to strengthen their work in the nosocomial infection management. We have to abide by the epidemic prevention and control work. 6. To all the rural areas, we need to provide security to the local residents. One of the top priorities is that for the local authority, they need to stay alert and remain vigilant, especially during Spring Festival. Even though there is no cases reported in certain districts, they still have to report the local situation on a daily basis. So also we have to give full play to the medical institutions in different places. So right now we have a 3-tier medical reporting mechanism. For example, for the county, they are responsible for the village, and the village need to analyze the situation for each household of the village. And to key areas, we need to emphasize that for some of the village officials and police officers and the risk management inspectors, these people need to come up with targeted services to the local residents. Meanwhile, in each district or community, we do need to have a NAT testing site. This is compulsory. We have to make preparation for the quarantine site. For example, if we have a large group of people who need to be isolated, or if there is an outbreak, we could bring these people to quarantine and isolation immediately. And also we need the provincial authority and the municipal authority to provide support to the rural areas when necessary. Actually, we have been emphasizing all of these measures for many times. So for the local authorities and also the local residents, we have to stay alert. We have to do a good job in each step of the epidemic prevention and control. Thank you very much. Next question, please. With Global Times, my question is also about the vaccine. And last time, for Sinovac, they're saying that for the protection rate is 50.3% in Brazil. But if we look at the data released in Brazil, the figure is 50.3%. Can you tell us how can we understand those figures? If we look at the protection rates, we are seeing that for the protection rate to the mild cases and the protection rate to the heavy cases, and these are quite different. Can you tell us more about these two different concepts? And actually today we have experts in vaccines, and I would like to invite him to give us a detailed explanation. Thank you for your question. And actually, you're asking a very technical question. Actually, I'm having a picture here. So we do develop a vaccine, the inactivated vaccine, the Sinovac vaccine. We have choose Brazil, Turkey, and Indonesia as 3 areas for vaccination. But we are using the same vaccines to be administered in these 3 countries. We have 3 different clinical paths for the vaccine. So I'm showing you some of the scientific results, because these results are coming up of the researchers from these 3 countries. Now you could see the protection rates. In Turkey, the protection rate is 91.25%. In Indonesia, and the protection rate is 65.3%. In Brazil, you're saying the protection rate is 50.3%. So if we look at these 3 figures, we are saying that the Sinovac vaccine is valid. So this is from one aspect, from a horizontal aspect. We will also want to go in details about the protection rate. I would like to point out our results in Brazil. So for some of the critical cases, if they are in hospital, the protection rate will be 100%. So meaning that for people, if they are taking the vaccination, they will not turn into severe or critical cases. And also we have see a figure, 77%, meaning that for some people, after they are receiving vaccines, maybe some of them getting infected, but very few of them, they actually have a mild symptoms. And also, we have some people who are going to the hospital, but as their symptoms they're quite mild, they do not need any medical treatment. So meaning that the protection rate is 50%. As we all say, for people who are receiving the vaccines, not all of them can secure the protection for 100%. For Brazil, we are administered vaccination to medical workers, and the incidence rate is 23% after they're receiving vaccination. And if this person is not a medical worker, if they are taking the vaccination, the incidence rate is only 4%. Meaning that if this person is a ordinary person, if they do not have a exposure of the virus, and then this person is not likely to be invaded by the virus. So that's why we see if the health workers, after they're receiving the vaccination, the protection rate is only 50%. So this is how we analyze the protection rate of the vaccine. According to the WHO standard, for the patients, we are classifying that into 0 to 10 rate. So right now, we are having the results from the health workers in Brazil, meaning that for the health workers who are working in Brazil, after they are receiving the vaccines, the protection rate is 50%. So once again, not a single one vaccine can have a 100% immunity. So by looking at these figures, it means that even though you're receiving the vaccines, it does not mean you're 100% immune from the virus. So today, I'm showing you the scientific results. But people may wonder, if I receive the vaccine, does that mean the protection rate is only 50%? Well, actually, that is not the case. By looking at this figure, you could see if you are taking the vaccination, if you are a medical worker, and then you're only like 50% possible to get infected. And also, if you are taking the vaccination, it is unlikely that you will be developed into a severe case or a critical case. But still, we still working on the vaccinations program, also working on the development of the vaccine. So we will pay close attention to all of those aspects. Next question, please. With CNG Finance Channel, and in Jilin province, we see a super spreader, meaning that the one person may pass the virus to hundreds of people, and some people will get infected, especially the elderly people will get infected from this super spreader. Can you tell us more about this situation and what message can we get from this super spread? Well, actually, that is quite common to see a super spreader. For certain patients, under certain circumstances, in a short time, he or she may pass the virus to a great number of people. And during the transmission of the virus, and this person may have a big impact. When we are looking at this super spread, actually, that's subject to the property of the variant of the virus. And also, we have to understand some of the behavior of this super spreader, and we have to consider a number of factors. And actually, in other countries, we also see some super spreaders. As we said earlier, a Hong Kong researcher saying for 10% of the patients, they may have a higher possibility to transmit the virus to others. And also in India, they are saying for 5% of the infected patients, they may cause the other 80% of the patients. So this is actually an explanation for the super spread. And earlier we have the super spreader in the Kashgar in Xinjiang, and also we do see the super spreader in Jilin province. And this is what we have seen right now. But what we need to pay attention to is when and how this super spreading occurred. And if we found some places which may have a higher incidence of the super spread, we need to take a more stringent epidemic prevention and control measure. For example, we have to reduce the gathering and to extend the social distancing, especially in sealed places. We have to avoid the gathering. And this is a very effective way to avoid the super spread. And second, we have to find out these super spreaders immediately. So maybe we could do it through medical check or also through the nucleic acid testing. By doing all of that, we can identify the source of the infection to reduce the possibility of the super spread. And also we have to encourage our local residents to exercise the stringent prevention and control measures. For example, they have to wear masks, wash their hands, and exercise social distancing. All of those measures are very effective to curb the spread of the virus. And also to specific areas, for example, the elderly homes, for places with concentration of vulnerable groups. Some prevention and control measures may not be implemented thoroughly, and this may have a risk of transmission. So we need to emphasize the prevention and control measures in those areas. By doing that, we can contain the spread. Thank you. Next question, please. With sudden weekend, we are aware that previously, for some residents, after they're being vaccinated, they're saying they have not yet developed antibody. Is that true? How we deal with that? For this kind of people, shall we give them more chances for vaccination or give them a different kind of vaccine? Thank you. I would like to invite Feng Zijian to answer your question. After you are being vaccinated, the majority of people are able to develop antibody. This actually being proven from scientific studies and research, meaning that 97% to 99% of the people who are getting vaccinated are able to develop antibodies. So this rate is actually very high. But there is a common situation that for the vaccines, they could not ensure that 100% of the population can generate antibodies. This is because personal differences. Right now, we are providing vaccination to a large group of people. We are not asking each one of the vaccinees to receive the antibody testing. And for some reason, if you are taking the antibody testing, we have to understand how you take this antibody testing. Because for some of the medical institutions, the way they're doing the antibody testing may generate different results.
评价疫苗保护的那个中和抗体的产生的免疫原性的，主要的还是要靠这个。
So the common way right now is to look at the comprehensive antibody testing. We have very limited number of laboratories to do this kind of testing. So you have to receive this kind of testing in a P3 laboratory. So my suggestion is that there's no need for you to take the antibody testing after you are vaccinated. Actually, this is also the suggestion from WHO. But for some people, if they do have a high exposure of the virus, when necessary, we may check the antibody generation for these people, but this only accounts a small group of population. Thank you. Today we have many questions because of the time limit. We have only last two chances for the question. Thank you. My question is to the Ministry of Transport. During the Spring Festival travel rush, how can we respond to the dual challenges brought by the epidemic prevention and control and the Spring Festival travel rush to make sure that all the people can enjoy the Spring Festival? Thank you for your question. As I said, for this year's Spring Festival travel rush, well, this is actually the first travel rush under the normalized epidemic prevention and control. As for the arrangement of the travel rush, we will draw on the past experiences and we will optimize the supply and demand and also to provide more measures for the emergency response. This year, as we are under the normalized epidemic prevention and control, and also we do see some features of the passenger flow. According to our estimate, we may foresee some problems. We have to focus on the following tasks to make sure that people can stay safe during the Spring Festival travel rush. First, we have to create a synergy for the transport capacity. We have worked together with the railway transportation, water transportation, as well as the aviation transportation. We have analyzing the transportation schedule for the buses, trains, and also the airplanes. We will publish the notification to different localities. So we need the local authorities to understand the situation, to understand the schedule of the transportation means, so that they can better meet the needs of the passengers. And also we need to come up with a very scientific transportation plan to give the best use of the transport capacity of different means of transportation. And also we need to work together with the trunk line service. We have to further communicate with our needs with the railway and also the aviation center. We have to understand the number of passengers to optimize the transportation routes. Especially during the Spring Festival, there may be some trains or boats or airplanes arriving in the evening. We have to extend the operation time and to improve the transport capacity. We need to make sure that we will not cause any gathering because of the delay of the transportation. So by doing all of that, we can better serve the passengers. Second, we have to focus on the road transportation. We need to give guidance to the localities to understand the cloud computing and also the big data so that they could better understand the transportation routes. If there are some congestions happened in certain routes, the local authorities have to better supervise those routes and provide more mobilization to improve the capacity of the transportation vehicles. They need to share this transportation information in different platforms. They have to publish the real-time transportation routes to guide the travel for the local residents. And also we need to better manage the toll gates and also do a good disinfection in some public places. And also we need to set up prevention and control points and to improve the efficacy for the control, provide more guidance to the transportation, making sure that there's no long queue or a big traffic congestion. Thank you. One last question. Thank you. I'm with the Health magazine. Start from last year, according to the virus tracing, we do see some of the infection are coming from the cold chain logistics. According to those results, does that mean we have identified the active virus from the service of the cold chain logistics? Will this virus be passed to other people? I would like to invite Feng Zijian to take your question. You are correct. And last year, we do found this situation. For some people that are getting infected from the cold chain logistics, cold chain food or other cold chain items, especially for seafood. And we do identify some active virus from the package of the cold chain food. For those viruses, they could cause infection to human beings because these viruses are still active. And after that, we are tightening up our measures for the testing for those cold chain food items, and also we are doing a lot of good job, doing a lot of work to protect people who are having contact with cold chain logistics. And later on, we also found some of the virus in other places other than the cold chain logistics. Because after we are entering into winter, the temperature is very low, and some of the virus stay alive in the surface of certain objects. And for some people, if they're getting in touch with those viruses, and they will get infected. Thank you. Thank you, all the speakers. And today in the press conference, our speakers have briefed us the situation about the prevention and control during Spring Festival. They're actually answering around 22 questions from 18 journalists. If you have more questions, please leave a comment. And right now, we are at a critical time for the prevention and control. Once again, I would like to remind all of you, let us join hands to abide by the epidemic prevention and control measures. One last notice. On January the 14th, the WHO expert group had arrived in Wuhan. Now they're in quarantine. In the past 1 week, we had many video conferences and discussed working plans. In July the 2020, we have reached a consensus on the work plan. We will continue to move along with the virus tracing. That is the end of the press conference. Thank you.